Hi guys, and welcome back to Wellness Wednesdays. Today we're switching things up a little bit and talking about cold therapy and professional cyclists. Does it help or does it hurt? Let's find out. So in case you guys don't know, I'm really excited about this topic because I do cycle on the weekends. I do mountain biking here in Arizona where I live. I also do road biking and we do bike touring with our dogs. So I'm constantly on my bike. I typically use my cold bath in conjunction with my indoor trainer, either to do the bath before and then hit the trainer so I'm not sweating too hard after the end of my training session, or do it afterwards to cool down. Or sometimes I do both just for the contrast therapy. But what I wanted to look into was whether or not professional cyclists are also using cold therapy. So we found an article from Cycling Weekly that was posted in April of 2024, where Rob Kemp was also asking that exact same question. And from what we found, most of the information he got came from a man whose name I cannot even pretend to pronounce, but is a medic for the team 𝐀𝐑𝐓𝐈𝐒, which I might also be saying that incorrectly. He told Rob that we use cold water immersion during the summer tours, and its chief benefits are body cooling in the heat and faster muscle recovery after exercise. Since heat also adds much stress to the heart, the sooner the rider cools down, the better they recover. He goes on to talk about how Dr. Laura Wilson, a senior lecturer in exercise physiology and nutrition at the London Sports Institute based in Middlesex University. And she talks about how cryotherapy has been shown to be an effective post-exercise recovery strategy, demonstrating that it reduced delayed onset muscle soreness. She specifically carries out studies that deal with cryo chambers and cold water immersion, and has flat out said that while cryotherapy chambers are the most intense, they're not cheap and far from mobile, so an ice bath can be just as effective, especially since they are mobile. And oftentimes you can get cold water out of your tap, making it more applicable to the everyday person. Now, 𝐀𝐑𝐓𝐈𝐒's team medic went on to say that during or after the ice bath, they do have a recovery shake with carbs and proteins. They also promote an active recovery session with post race with a 15-minute easy spin on the rollers. And then during the bus ride back to the hotel, some riders do wear compression garments just to help with that inflammation before they go do their massages to prepare for the next day. Again, one of the reasons that I started looking into this was because the Tour de France just finished, and the Tour de France is a 21-stage race. So for those of you who don't know, the cyclists are pretty much racing every day for 21 days. Some days can be fairly mountainous, some stages can be fairly flat, but all stages are extremely demanding on the athletes. Now, he went on to say that they do have a portable bath on the team bus. They just fill it at the finish line with cold water, and riders go in with their legs immersed for 5 minutes at a time. At UAE Team Emirates, two-time Tour de France winner Tadej Pogačar is another pro who values a post-race quick dip in a paddling pool full of ice. And according to his medical director, he's one of a number of pro athletes who take ice baths for its psychological benefits as much as the physical ones. He went on to say it's not intended for recovery or performance, but just to allow the rider to feel better after the stage. We don't do prolonged submersions because the longer the submersion, the more deleterious it is to the performance. It's purely just to cool down the body temperature. So what he's saying is they're not doing the cold plunges for the sake of the muscle soreness so much. It's because it's so hot and they are so sweaty at the end. Getting the ice bath helps bring their internal body temperature down very quickly, therefore allowing them to recover faster. Pogačar's teammate Adam Yates is also taking a cooling down in the team's ice-filled inflatable paddling pool after a stage, which is not really surprising considering he partially blamed the heat of the French summer for the time he lost the Tour in 2018. Tom Haynes is a sport and exercise psychologist and coach at the University of Nottingham, and he says that he has found another reason to do cold therapy. He says an often overlooked benefit that comes from putting yourself through something unpleasant like an ice bath every few days is that you'll find that your grueling training hill ride in the freezing rain is marginally easier to manage mentally if you can tell yourself this is nothing compared to that ice bath yesterday. And being that this comes out of the UK, it is pretty cold and rainy there a lot, so that makes sense. This also backs up the theory in a 2020 study published in the International Journal of Environmental Research and Public Health that found cold water immersion can have a positive effect on the endocrine system and the psyche, including reducing the symptoms of depressions, which we did do another video on the benefits of cold therapy on anxiety and depression. If you want to see that, just scroll back through the playlist. It should be there. We go on to talk about the parasympathetic nervous system and, of course, how working out the parasympathetic nervous system is great for just all-around resilience and recovery. A study carried out in Milan concluded that before exercise, intense cold exposure may positively affect the body, for the autonomic nervous system point of view. The research team carried out a study among 28 cyclists, monitoring their heart activity before, during, and after exercise to measure how cryotherapy affected performance. What they found was an increase in the mechanical power that the athletes were able to exert. The time to exert maximal work increases proportionally to a persistent reduction of sympathetic tone. And this also goes hand in hand with what we talked about with the rise of testosterone thanks to cold therapy. Doing cold therapy and then doing a hard workout can be massively beneficial from a hormonal point of view. They went on to say that during exercise, core temperature increases due to heat production resulting from muscular contractions, and this increases thermal strain, which negatively impacts endurance performance. Cryotherapy can be used before exercise to reduce core temperature, thereby allowing cyclists to exercise for longer or tolerate higher environmental temperatures for longer. And that kind of plays hand in hand with what I was saying about doing my cold plunge and then doing my trainer bike, because my bike is in my garage, which is not air conditioned. Because I do ride outside in the desert, it does get very, very hot. And I have found that if I do a cold plunge and then do a bike ride, then I can ride for longer. And then when I do my cold plunge, when I get back, it's one, not as big of a shock going from the heat to the cold, and two, it aids in that recovery. Potential pitfalls with it, of course, if you are not in good physical condition, you've not checked with a doctor, then rapid immersion in icy water can potentially send you into shock or even heart attack. So it's important that you consult a doctor. It's also important that you are very careful if you are using Wim Hof's breathing methods when you are in the cold therapy, because he does talk about holding your breath, which can be very detrimental in the cold water. It also increases the risk of fainting or hypoxic brain injury. So it's very, very important to breathe. Not saying that Wim Hof's breathing techniques don't work, but they can be very, very dangerous if you're not doing them correctly or if you don't have someone there to watch over you. The same professor that talked about the pitfalls also said that you may be better off doing an active warm down on the rollers rather than taking a cold dip. Further examination can back this up, suggesting that cold water immersion is no more effective than acute recovery for reducing inflammation or cellular stress in this single bout exercise model. But again, as talked about from the medic, they're using the cold water more to cool down the body's core temperature than they are for the actual muscle recovery. So they're looking at it from two different perspectives in this article. He also goes on to talk about what we talked about with if you're trying to gain muscle. Since CWI reduces the inflammatory response to exercise-induced trauma, it may be, in fact, counterproductive. Using ice baths for rapid recovery after a hot race is fine, but dampening inflammation during recovery is something I'm skeptical about. You don't want to reduce inflammation rapidly because it's part of the process that helps us fully recover, repair, and build back stronger. Why would you want to stop that? And again, if you're going for muscle gains, that's absolutely correct. You don't want to do a hard, strenuous muscle building workout and then go sit in the ice for 5 to 10 minutes. It's going to completely negate what you've done. Well, it's likely to completely negate what you've done. One thing I really liked about this article was it looked at all sides and it did talk to multiple people. And so it brings an interesting question. Ice baths for the sake of cooling the body temperature down. Is that really what's giving cyclists an edge, or is it the muscle recovery? Based off of this article, I'd say there's more research that needs to be done, but I do find it interesting that a lot of the Tour de France cyclists are using cold therapy as a means of recovery. I would really be interested in seeing more data come out on it because I think it'd be really interesting to study. The second article that we found that we'll link to in the description was from a cycling injury expert who talks about what he thinks about hot and cold therapy and when to use them. Doesn't really go into the science of it, but it was kind of an interesting read. And then unfortunately, a lot of the other articles we found were from ice bath companies. So of course, they're going to be talking about how great they are for cycling. So we didn't do too great of a job finding a lot of articles on here. We're going to keep digging and maybe revisit this in the future. But I hope you found this somewhat eye-opening and informative. If you did, please do hit that like and subscribe. Share this with somebody you might know. If you do cycle, let me know what kind of bike you ride. I'm always interested to know. And if you're more of a mountain biker, gravel biker, or road biker. I do like that they did talk about the psychological benefits of cold therapy, and of course, caveating off of that with, I need to talk to you about the Ice Wellness Journal. The Ice Wellness Journal is designed to help you track your plunges, time of day, if you eat and if you haven't eaten, so you can best determine what time, temperature, duration, etc. is best for you when it comes to your cold therapy, but also so you can track how your mental and emotional growth is going with the use of cold therapy. If you find you're having problems getting past the mental block and you absolutely do not want to get in the ice, we also have our 30-day challenges. So this is a monthly subscription. It goes out every 30 days. Our subscription is cold therapy coaching to you. So regardless of if you do it in the shower, in your pool, in your bathtub, or in a fancy pod setup, you get the benefit of having a coach to guide you through the session, as well as give you some guided exercises afterwards to help you warm up naturally and in a way that is beneficial for your overall health. Thank you so much for watching this video, and we'll see you next time.